Edutainment Studios and Access Healthcare welcome you to Allergies, Easing Your Symptoms. This module is part 2 of a 3-part series on allergies. When you have allergies, your body reacts to something in the air called an allergen. Allergens can be in the air outside or inside, so knowing how your body reacts to allergens, what symptoms or complications you may have, will help you to know what you can do to control your symptoms and not them control you. In this course, the objectives are to help you know what causes allergies, what are your treatment options. To diagnose allergies, a doctor can give you a physical exam and ask you questions about your symptoms and medical history. They may also suggest allergy testing. Most allergies are caused by one or more of the following common allergens: grass, tree, and ragweed pollen. Pollen is released into the air by trees, grasses, and weeds at certain times of year, depending on where you live. The weather affects how much pollen is in the air at any time. The amount measured is called a pollen count. If you have one type of pollen allergy, you are more likely to develop allergies to other types as well. Mold. Some molds give off allergens in their spores. These molds grow indoors year-round and outdoors during certain seasons. Indoors, mold grows in dark, warm, humid places like damp basements and bathrooms. Outdoors, you will find mold in moist, shaded areas such as soil or fallen leaves. Dust mites. These are microscopic bugs that live in dust indoors. Dust mites do best in soft, warm, humid places like in your bedding, stuffed animals, and carpet. Pets. Dander and saliva from animals are full of proteins that can cause your symptoms. You can also be allergic to the urine of guinea pigs and rodents. Cockroaches. Cockroach bodies, droppings, and saliva are full of proteins that you can be allergic to. You will often find cockroaches in older homes, cities, and crowded areas. The best way to treat your allergies is to avoid what you are allergic to. When this is not enough or is not possible, your doctor may suggest other treatment. There are 2 types of treatments for allergies: medicines and immunotherapy. Medicines can be over-the-counter or prescription. You take some medicines daily and others only when you have symptoms. Some common medicines include antihistamines. These are usually pills but can be nasal sprays or drops. They block the effect of histamine in your body to ease the symptoms. Nasal corticosteroids. These are nasal sprays that help keep the tissue in your nose from swelling. Decongestants. These are liquids, tablets, or nasal sprays. They narrow your blood vessels, which helps reduce stuffiness. Nasal ipratropium. This nasal spray helps relieve a runny nose by keeping the glands in your nose from making too much fluid. Leukotriene inhibitors. These pills block leukotrienes. This is another chemical that your body releases that causes allergy symptoms. Allergy shots are the most common type of immunotherapy, but there are also tablets that dissolve in your mouth that treat certain types of allergies. Immunotherapy works by slowly giving you tiny amounts of the allergen that causes your symptoms. Over time, your body gets used to the allergen. Immunotherapy may relieve your allergy symptoms for good, or you may need to have it repeated throughout your lifetime. Please feel free to investigate these other sites for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for part 2 of this 3-part series on allergies.